Injecting new fervor into efforts to combat AIDS, world leaders at the UN AIDS Summit resolved to end the epidemic by 2030. Nations committed to a 5-year strategy to ramp up access to life-saving medicines, reduce HIV infections and AIDS-related deaths, and end the stigma surrounding the disease.
We would reaffirm the commitment of the government of Mali for the objective
to end AIDS as a public health threat by 2030.
As our legacy to the present and future generations.
The U.S. pledged to create a $100 million fund to boost access for medicines and services for the most vulnerable patients. And there was more good news. Armenia, Belarus, and Thailand have eliminated mother-to-child transmission. Clinical trials on vaccines have been promising, and research into a cure hints at a possibility of a future free of the AIDS epidemic. But rates of transmission have been spiking in Eastern Europe and Central Asia. Millions in West and Central Africa still don't have access to life-saving antiviral drugs. And discrimination and myths still persist around the disease that has plagued the world for 4 decades, especially against key populations where the risks have been higher. Men who have sex with men, intravenous drug users, and sex workers. As governments and world agencies fight the good fight, activists say these groups must be protected to ensure no one is left behind. Liling Tan, CCTV, New York.